Welcome, English learners, to English Class channel. Reading Comprehension. Schizophrenia.
Struggling with reading comprehension? In this video, we'll help English learners develop the skills needed to understand passages more easily by expanding your vocabulary and training your brain to process information as you read. You'll improve comprehension and make reading more enjoyable, perfect for students, language learners, or anyone looking to strengthen their reading skills. Instructions: pause the video whenever necessary to review or understand key points. Adjust the playback speed to a pace that's comfortable for you. Take notes to expand your vocabulary range. Rewatch the video as often as possible to improve your reading skills. Listen to my reading, try shadowing along, and then practice reading it out loud on your own.
Section 1. Pre-reading. Psychiatrist is a medical doctor who specializes in psychiatry. They treat people with mental illness. A mental illness is an illness of the mind. The term includes psychiatric disorder, psychological disorder, mental disease, mental breakdown, nervous breakdown, mental health conditions. A hallucination is seeing, hearing, tasting, smelling, or feeling things that do not really exist. Usually, people have to be awake and conscious to have hallucinations. A mood is an emotional state of mind. They can be positive or negative. People sometimes say they are in a good mood if they are happy, or a bad mood if they are sad or angry. Schizophrenia is a mental disorder that is usually diagnosed by a psychiatrist and affects an individual's daily life. For some people, it is a lifelong mental disorder that causes them to behave, feel, and or think abnormally. Schizophrenia can cause psychotic symptoms like hallucinations or delusions. However, not all people with schizophrenia have these symptoms all the time. Schizophrenia can also cause problems with cognition, thinking, and mood. Schizophrenia is a common disorder affecting 1 in 200 people. However, its exact cause is unknown. Genetics and or environmental factors may play a role. If one child in a family shows clear signs of schizophrenia, there is a higher risk that other family members will have these same symptoms. Section 2. Pre-reading. Self-injury or self-harm occurs when a person hurts their body on purpose. This kind of harm is not suicidal behavior. Therapy in the medical field, also called treatment, is what people do to try to solve or care for a health problem, physical or mental. People with schizophrenia typically have a higher risk of self-harm compared to the general populations. This might be due to hallucinations, depression, and or other factors. Prevention is difficult because there is no reliable way to find out in advance who will get schizophrenia. Attempting to prevent schizophrenia in the pre-onset phase with antipsychotic drugs is of uncertain benefits and so is not recommended. As of 29, the British NICE guidelines recommend cognitive behavioral talk therapy for all people at risk. Schizophrenia is treatable. Many people with the disorder live normal lives with a combination of a therapy and medications. Schizophrenia and dissociative identity disorder (DID) have some of the same symptoms. Some similar mental illnesses include schizotypal personality disorder, schizoaffective disorder, and schizoid personality disorder. Section 3. Pre-reading. Speech is when spoken language is used to communicate. Only humans have language. Symptoms. No medical tests can show that a person has schizophrenia. People are diagnosed based on the symptoms they report and show. Doctors and psychologists sometimes disagree on whether a person has schizophrenia. For example, lists of schizophrenia symptoms include wording like disorganized, not organized, or oddly organized speech present for a significant portion of time. It is difficult to agree on what exactly disorganized speech is and how disorganized it has to be to receive a diagnosis. The symptoms of schizophrenia fall into three main categories: positive symptoms, negative symptoms, and cognitive symptoms. Section 4. Pre-reading. The sensory system is the way animals find out about their nearby environment and their bodies. To do this, they have special devices for collecting data called sense organs. A delusion is a false belief held by a person. When doctors talk about delusions, they mean that the false belief is the result of some disease. Positive symptoms. Positive symptoms are thoughts, behaviors, or anything experienced by the senses that are not shared by others, like hearing voices that are not really there. They are called positive not because they are good, but because they are added. These symptoms may include having strange thoughts that do not make sense, delusions, having difficulty organizing thoughts and speech, feeling, hearing, seeing, smelling, or tasting things that do not exist, hallucinations. A person can also have these symptoms if they have stopped taking antipsychotic or anti-vomiting medicines too quickly. Delusions and hallucinations. People with schizophrenia often have delusions or hallucinations, as estimated by the IPSS. About 70% of schizophrenic individuals experience hallucinations. Section 5. Pre-reading. A gesture is a form of non-verbal communication. Unlike verbal communication, which uses words, gestures use movements of the body. Bipolar disorder, also known as manic depression, is a mental illness where a person will have repeated long-lasting feeling episodes of high mania and low mood depression. Negative symptoms. A person is having negative symptoms when they do not have thoughts, behaviors, or emotions that healthy people have. For example, they do not show any emotion on their face. They have a flat effect. They speak slowly, using very short words. They move very little or do not use gestures. They cannot feel pleasure. They do not feel interested in anything, including other people. Being unable to act spontaneously without playing first. Negative symptoms, as the name suggests, essentially take away from life and day-to-day interactions, making it harder for people with schizophrenia to have meaningful relationships with the people around them. If a person is having negative symptoms, they do not necessarily have schizophrenia. These can also be symptoms of depression, bipolar disorder, or other mental health disorders. Side effects of medications like antipsychotics, antidepressants, sleep medications, and anti-anxiety medications. Section 6. Pre-reading. Attention deficit hyperactivity disorder ADHD is a neurodevelopmental disorder. It affects how people think and act. Cognitive symptoms or cognitive deficits. Cognitive symptoms can include problems paying attention, not remembering things, not having a concept of time, being unable to plan and organize. Of all of schizophrenia's symptoms, Cognitive symptoms are the most disabling because they affect day-to-day activities. Also, it can be difficult to recognize them as part of the disorder. Like with negative symptoms, a person does not necessarily have schizophrenia if they are having cognitive symptoms. Cognitive symptoms can also be symptoms of depression, ADHD, or other mental health disorders. Side effects of medications like antipsychotics, antidepressants, sleep medications, and anti-anxiety medications. Symptoms of medical problems like dementia. Section 7. Pre-reading. Harm is physical or psychological or emotional damage or injury to a person, animal, or other legal entity. Aggression refers to behavior between members of the same species that is intended to cause humiliation, pain, or harm. Treatment. Treatment of schizophrenia may include medication to help treat the symptoms. Different types of schizotherapy. Therapy by a professional, such as cognitive behavioral therapy and many rehabilitation therapies. Therapies restoring things to how they were before, such as cognitive remediation therapy, cognitive behavioral therapy, CBT, is a talk therapy that focuses on helping the person to think about their strange ideas, delusions, in more realistic way. The therapist may design a behavioral experiment for paranoia, false beliefs of danger, that will help the person to find out, for example, if there really are cameras everywhere in the house. For hallucinations, cognitive therapy focuses on normalizing many people hear voices without being stressed. And we all hear voices in the form of thoughts. It is just that people with schizophrenia hear them a bit more clearly than most people. A 2006 survey of 941 patients from 7 studies found no clear evidence that treating schizophrenia with antipsychotic drugs early is effective. There is some evidence which shows that early treatment with drugs improves short-term outcomes for people who have a serious episode of mental illness. These measures show little benefit 5 years later. Some of the goals during the acute phase of treatment are to prevent harm. To prevent harm, the person being treated will have the severity of psychosis and its symptoms reduced. These symptoms include agitations, aggression, negative symptoms, self-disorder, and thought disorders. Don't forget to subscribe to English Class channel. Thank you for watching. If you enjoyed this video, you definitely enjoyed this one. Keep reading and see you next time.